I'm Jane Craigin. I'm the CEO of the hospital here, and I'm very pleased to welcome all of you to this celebration that we're going to have today. I'm very pleased to be joined by the Lieutenant Governor, Becky Skillman. And we are here today to celebrate our ability to bring fiber net broadband access to our community through a grant. And I think most of all, the thing that we need to recognize here, besides our ability to have faster internet and those things that's going to bring us, is our community partnership. It would not have been possible if it hadn't been for our bi-county community partnership for this to happen. And I want to recognize many of those people are sitting here in the room today, took lots and lots of meetings to pull this off. We have our Warren County government, our Warren County Local Economic Development, the City of Attica, the Western Indiana Community Foundation, and corporate donors. If it hadn't been for them coming together as a community, this would not be possible for any of us. And last but not least, our Indiana Rural Health Association and our IFN, Indiana Fiber Network. That's actually, if you come to Attica, you see the digging, they're the people doing the digging. So at that, I want to thank you all from the bottom of my heart, and I know the community will too, for what this is going to do for us. And basically, what is it going to do for us? I've had lots of people ask that. If you're not a techie, and I'm not really, well, I'm technology challenged sometimes, but in saying that, it is really going to help our patients. It's going to help our patients that we're going to be able to have fast internet, broadband here as we move towards all electronic medical records, our radiology system. We already are electronic here, but it's going to speed those films even faster for us. Also for telemedicine, and I think as most of you maybe have read or seen, telemedicine is on the forefront of technology today. So we could actually have subspecialists that we don't have access to today, sitting in California, that would be able to actually communicate, see our patients, and deliver services that we cannot be possible to deliver on our own. So those are just things in the future that we'll be able to have. And actually, I think it's going to make that system more affordable for us too, as far as line charges and that. And there's many, many more things that the community, again, is going to benefit from. And I think you'll hear a little bit of that today, our schools, our businesses, just our home, hopefully our home internet usage of that. So at that, again, thank you very much for community partners coming today and sharing that with us and making that affordable and available to us. So at that, I would like to introduce the next speaker, and that's Kelly Dyer, President of the Indiana Fiber Network. Kelly?
Thank you. Good afternoon. Appreciate the opportunity to come to speak to everyone today, and really thank you for the opportunity to be part of this kickoff. The telehealth network that's coming here will be a great advantage to the community, will be a great advantage to this hospital. And through this association, services will be not only enhanced here, but enhanced throughout the community. In regards to the services that will be delivered here at the hospital, some may only see these as a cost-effective fiber-based access to the internet, but I see so much more. The circuit used for the internet also goes to a centralized connection point in Indianapolis that we call the Joint Shared Platform. This centralized connection point is a gateway to the transmitting of data between the hospitals, hospital service providers, and other entities. In time, medical record sharing, X-ray and MRI transmissions, and excuse me, my bifocals I'm not used to yet, if I get offline here. In time, medical record sharing, X-ray and MRI transmissions, educational video, and video consultations between physicians will far exceed the internet usage on the centralized platform and will be a very valuable asset, not only to St. Vincent Williamsport Hospital, but also to the other medical facilities connected to this platform. Currently, there are 18 medical facilities already connected or contracted to connect to this platform, with additional facilities to come. This project has been a great example of what a private-public partnership can accomplish if they work together. They took the efforts of the Office of Community and Rural Affairs of the State of Indiana, the Indiana Rural Health Association, St. Vincent Williamsport Hospital, and St. Vincent Health, along with county, city, and local community leaders and entities, in conjunction with the efforts of my staff to make this project a reality. While not all federal programs accomplish what they set out to do by a long shot, this one is going to accomplish what they had hoped it would. That of connecting healthcare providers in rural areas to the urban areas across the state and eventually across the nation. In regard to economic development, while the enhancing of services that are available to this hospital is economic development in its own right, the additional technologies available upon project completion will also be a very valuable tool in the recruitment and retention of businesses in the surrounding communities. While not the only factor in choosing a location for a business, not having competitively priced fiber-fed technologies in a community is a deterrent to the recruitment of new business and the retention of existing ones. In closing, let me say that we are very pleased to be part of this initiative, and we look forward to working with the hospital, local community, leaders, and other entities to expand it in the future. With that, I will turn it over to Don Kelso, Executive Director of IRHA. Don.
Thanks, Kelly. The things that Jane and Kelly have talked about are very true, but I just want to put just a little bit of a timeline to it and maybe name a few people specifically. This process actually started in Indiana about 3 years ago, maybe a little longer. There's a few people here in the room that were meeting regularly trying to obtain this money. John Hill's one of them. David Terrell back there, to just name a couple. And thanks to the Office of Community and Rural Affairs, like Kelly said, with the leadership of Lieutenant Governor Skillman and David Terrell and Jeff Shoemaker, the state of Indiana was able to obtain funds to pay for 85% of the construction project, which you are going to enjoy here in your community. What made it possible, though, really, was none of those funds could be used for administration or to make the project work. This project is, and in this case, like I say, it started 3 years ago. So for IRHA to be able to help make things happen, the Office of Community and Rural Affairs had some grant money that enabled me to hire Becky Sanders, who has been the mover and the shaker and the pusher to make this happen, help make this happen. I'd also like to recognize Steve Everly. This was one of the more expensive construction projects. There was no fiber close by, as you know. We're into the holiday season. We talk about over the river and through the woods. Well, here I think they might have to come under the river and over the woods. I'm not sure exactly how they're going to do it, but it made this project over $1 million, and that was just cost prohibitive to come up with a 15% match. So thanks to Steve and Jane and John and the people that Kelly mentioned that I have not met, all these forces came together, and one day we got a call and said, hey, it's possible. And it's just really such a good feeling after 3 years to see it. This is exactly what was intended to be when this vision started with Lieutenant Governor and David and some other leaders around the state. The fellows at IFN, you've met Kelly, Rob Ramsey, August Zahner. They've been great partners. They've been putting a lot of fiber in the ground all around the state. So now that Indiana is really in pretty good shape, there's a lot of a good footprint of fiber to really help with the healthcare needs that Jane talked about, and also economic development. And like I said, I'd like to say great big thanks to Becky Sanders and also Jim Miller. He's been very helpful to assist Becky. And this is part of the first project. We've since started a second fiber construction project, and we're even considering a third because the state was awarded about $16 million. And we had 5 years to spend it, and by golly, we're trying to spend every penny of it. So we're trying to find projects like yours that are feasible so we can help make a difference. So thanks for being here. We're very happy to be here. It's a great thing to see happen. So I mentioned her name several times, but she truly is a friend of rural Indiana. We keep running into each other as we go to these communities. I know she's traveling all 92 counties, so please welcome Lieutenant Governor Becky Skillman.
Well, Don, thanks so much for the kind words, but most of all, we thank you for being a longtime champion of our rural communities in Indiana. And he's right, our paths do cross regularly, and it's great to be here with so many partners in progress. From the hospital leadership and hospital staff here today, our Indiana Fiber Network folks and Indiana Rural Health Association, my fellow elected officials, of whom we have many here today at the city, town, and county level, and a special shout out to one of our partners at the State House, Senator Bill Boots, with whom I get to work every day when the legislature's in session. And he's been a great supporter of our policies that allow us to help our small citizen towns move forward as well. So thank you, Bill, for being here. It was mentioned for a second or so that I'm on what we call the Hoosier Crossroads Tour. What does that mean? I plan to be in all 92 counties again over this next year. Today in Warren County was my 19th or 20th, so we have a little distance to travel yet. But when I spend nearly an entire day in the counties, we begin in the morning meeting with the elected leadership at the city, town, and county level of government. We have a great conversation about how we can all work together to better serve Hoosiers. And typically in the afternoon, we visit some projects that have been funded by the state, some programs that have been started or partially funded by the state. But in this case, it's extra special here today when we get to celebrate bringing Warren County and St. Vincent Hospital into the Indiana Telehealth Network. So we thank all of you for being here to celebrate. I know this has been mentioned, but we are especially thankful as well to the county officials, to Warren County Economic Development. I can't say enough about Steve Everly, who's been just a great partner in so many ways. You may not know that he's traveled the globe with me on trade missions as we all work to bring back more opportunities for Hoosiers. And I know he was a great part of the push behind this development as well. So Steve, we thank you. And appreciate all of the time and the effort and the resources that went into making this venture possible. I also want to thank Attica. We have Mayor Shepherd here with us today, Clerk Treasurer Sharon Nagel with us, and I know that Attica understands when you work toward the development of one county, it certainly provides a boost for the entire region. This entire region will prosper from what we're doing here today. It was a year ago, it was October of 2010 when we launched the Indiana Telehealth Network. So I couldn't be more proud to be here today to show that we continue to make success, and we made great success in just a year's time. We have had strong private and public partners all along the way. We mentioned Indiana Rural Health Association. We want to thank your member institutions as well, Don. And the Indiana Telecommunications Association was a great partner all along the way. We mentioned 2 state agencies that have played a role. Our State Office of Technology and the Office of Community and Rural Affairs. David Terrell is here today as well, our Director of the Office of Community and Rural Affairs, standing there in the back. So you know now, if you appeared today to find out what's going on, you know now that we are linking our rural hospitals, our rural health centers with high-speed fiber optic broadband. I think we all know that broadband is the most reliable way to move health information from point A to point B. And I will admit it's been our goal in state government and for quite some time now to get every city and town and rural county online. It doesn't happen overnight. But today, we're not only celebrating bringing St. Vincent Hospital into a level of connectivity, we are actually celebrating better communication for all of Warren County and surrounding areas as well. I think you know the benefits for the individuals, the families, the tremendous. And then when we take that level of connectivity and apply that to excellent healthcare facilities, it just takes this excellent system to a whole new level of service. One of our best resources to improve healthcare is technology. And I'm very proud, of course, that Indiana is at the forefront. We are quickly outpacing the rest of the nation, I'm proud to say, as more and more of our hospitals have the ability to see each other's patients' records electronically. So this network, of course, opens more doors for doctors and for patients. They will now have access to specialty services, specialty treatments from anywhere around the state, the nation, and the world. Telemedicine makes it faster and easier to diagnose and to treat the patients. And maybe most important, takes away that need to actually see a doctor from time to time. And I think especially in our smaller cities and towns, traveling a great distance to an urban hospital can sometimes be a barrier to getting the proper treatment. So this, of course, may allow now some of our rural residents to stay much closer to home. It will help them keep their dollars closer to home as well. And not only for St. Vincent here, but I want to thank all of the hospitals, rural hospitals throughout the state, who are essentially serving as a home base for broadband in their communities. Because they're not only providing better service to the patients, but they're opening doors of better connectivity to their entire community. And we know too that the healthcare facilities with telemedicine have shown great returns on their investment. That's not only investment financially, but we find that the patient and doctor convenience and satisfaction is at an all-time high as well. So we certainly look forward to all of the improvements that will occur now in Warren County healthcare services. But I want you to know you are taking a huge step forward for this community, for our overall healthcare system, and for our ongoing statewide development. So I want to thank everyone who had a special role to play in this initiative.
I'll take a photo of the share.
We didn't get Bill.
One more.
Yeah, Senator.
Yeah, come on, get over